Hello everyone, welcome to my presentation. My name is Marco Pena, and in this video I will be talking and going over therapeutic use of exercise in the field of recreational therapy. So my name is Marco Pena, like I said before, and let's get started. First we're going to go with some basics. We're going to ask ourselves the main purpose of this presentation. What is um, therapeutic use of exercise? So there's a wide variety of physical activities that they mainly focus on recovering and maintaining the patient's overall health. So whenever we see that someone undergoes some type of accident and they are left injured, we know that they lose some mobility of the affected area. It could be legs, could be arms, could be any other affected area. So through the use of these therapeutic exercises, we are going to, our main purpose is for to bring the injured person back to a fully functioning state. So we have to do this while taking away any type of pain from the patient. So we are going to, through these exercises, work on endurance, strength, stability, balance, and flexibility. So these are all the areas that therapeutic exercises are going to help our patients um, with. And yeah, therapeutic exercises may include aerobic and endurance conditioning, and also reconditioning as well. Agility training, body mechanics training, breathing exercises, coordination exercises. These coordination exercises are going to help our patients in the area of stability. So, developmental activities can also be trained through these exercises. Muscle lengthening, movement pattern training, neuromotor development activities training. There are plenty of exercises and areas that could be improved after a patient is injured. Moving on to the next slide, we have why implement these therapeutic exercises. So there are a lot of reasons why we should implement these therapeutic exercises. One of them being reducing pain from body and reduce inflammation. So as I've mentioned before, reducing the pain from a patient who's experiencing an incredible amount of pain from the affected region of their body is priority for RT professionals to work on. So yeah, once the patient is free of pain, we'll find new pathways for their full recovery. So these exercises will have a variety of them that will need to be initiated, and we do this through different sets of exercises that have already been predetermined to be to be effective for certain different injuries, types of injuries. So in order to regain motion of control um, of some of the affected areas, we put into place these exercises um, that are usually implemented by the RT professionals. These exercises are implemented for recovery of the muscle strength and endurance. We know that every time someone gets injured, even let's take for example an athlete who suffers an injury on their Achilles, they're gonna have to go several months without playing the sport, and this is going to increment or increase their muscle mass, and it's going to reduce their muscle strength and endurance. So during this process, we need to help the in this case the athlete regain some of that mobility that has been lost, and increase the range of his motion, um, because we know that because of inactivity the muscle is going to be affected by this injury. A little bit of background on therapeutic use of exercises, it wasn't until the 19th century that the implementation of exercises for therapeutic purposes really had advancements. So yeah, there were little achievements, but it wasn't really like nothing big until the 19th century was that we actually started seeing results on different researches done by very influential people. For example, we have Henrik Ling, who was the father of the Swedish gymnastics. He was the founder of the Royal Central Institute of Gymnastics in 1813. He did this so individuals who were ill could fight their way back to full functioning bodies through gymnastics. This was one of the earliest initiatives that someone actually took into the field of physical therapy or recreational therapy. In the 1950s, physical exercises started to be used beyond hospitals. So, yeah, up to this point, most physical exercises were only being used in hospital facilities. During the next 2 decades, huge advancements have been made in the fields of physical therapy, recreational therapy, and occupational therapy. We know this. I mean, it's kind of obvious as technological advancements have been have been made by the society. Incredible amounts of research has been done, and we have had implementation of some of this assistive technological gadgets that we now use nowadays, and these have helped fields like the ones that I just mentioned. So, purpose of these exercises, like I said before, the main purposes that we want to help the patient accomplish are enable ambulation. We want to make sure the patient is able to walk by themselves eventually, depending, of course, on the injury. This in order for them to be able to perform daily tasks and go back to living the life they had before the injury. Mobilize joints. This is very important. We know that our joints, with time, they become very weak, and sometimes with cold weather, we can have some injuries. And joints are really what helps our limbs just move the way they do. So, and pain on joints can be one of the worst pains someone can endure. So, improve overall circulation. Circulation is a really big, important fact that people suffer when it comes to injuries. We have to make sure that we improve their circulation in their body. So, respiratory capacity, we want to improve their respiratory capacity. Coordination and balance, these can go hand by hand. Reduce rigidity, so sometimes our muscles can feel kind of rigid and like non responsive at times. So, we want to make sure we erase this. How? Through the release of tension from muscles and tendons as well as fascia. This is really important. Some theoretical foundation. It is important to choose a model of disablement. This is part of the theoretical framework of practice. RT professionals need to provide evidence that there are indeed links between the injury and the designed treatment. The patient's assessment plan and evaluation play a vital role during this treatment. What populations can be benefited from this type of exercises. So the elderly, systematic use of therapeutic exercise has been supported by plenty of research to help regain or improve mobility of body and reduce pain in joints. So we know that physical therapy can give seniors, back their independence and also make daily tasks easier for them. Working with a physical therapist will not only reduce pain, but it can also help improve the overall strength and ability to reduce the risk for injuries, helping them maintain a really good quality of life. Another group of population that these treatments might be directed to are children. Children, kids that might have injuries can regain control of their muscle and improve their range of motion. Like I mentioned before, a kid is engaging in, say, their favorite sport and they get injured, they're going to have to go through, maybe they'll have to go through surgery. Depend. All cases are different, but it has been proven through data and real life cases that kids can g- regain their range of motion by implementing different sets of exercises. Adults are with different conditions that affect pretty much all three populations can be benefited from these exercises. On adults with different conditions that affect balance or muscle, they can have different treatments to help fight these conditions through the use of exercise. Now we're going to jump onto the implementation of the exercises. So it involves movement prescribed to each appropriate impairment. Um, Endurance exercises, strengthening exercises, flexibility exercises, and balance and coordination. So these are the most common and most popular areas that the therapeutic use of exercises are going to be affecting. So yeah, this all of this will help the patient restore muscular functions as well as skeletal functions in order to maintain the patient's well-being. We're gonna jump to the implementation still. We're gonna go with strengthening exercises are mainly performed with heavy resistance. So I mentioned before the most popular um, areas that these exercises work on. So more specifically for strengthening exercises, these are mainly directed to work with heavy resistance and less repetitions. Now, for an effective endurance exercises, we have to understand that these engage large muscle groups over longer periods of time. When it comes to flexibility, these are achieved through stretching and movement. And finally, we have balance and coordination, which will help our patients with stability, and these mainly focus on maintaining a person's center of gravity. Then we go to implementation and exercise performed. So for this step of the presentation, I chose to perform this specific exercise on a cousin of mine that lives in Houston who was here visiting recently, and I decided to perform it on him. And I have to say that he loved it. He said that he really felt like his um his leg was so much better after doing these exercises little by little, and eventually as he progressed it got to the point where he gained full mobility of his leg. So in this case, where the injury that I will be implementing this exercise on is specifically on a bike accident. The right knee has been injured and surgery was required. So the aftermath post-surgery, it is clear that the patient now has gotten weight and has significantly lost mobility of the right leg. So the patient is obliged. So he has to rest. He has to have some resting days, and little by little we're gonna have complains that his right knee hurts a lot due to joint being damaged. So yeah, during the accident, of course, the joints were damaged, but through therapeutic exercise, we are going to try and help him decrease the pain from his joints. How? By asking him to slowly move his toes. Also, move leg in the circular motion with the help of an RT professional. Just this is in case that the this depends on the severity of the injury. If it's very severe, then it will require some help from an RT professional. And we're gonna implement some walking for at least 20 minutes per day, 100 and 110 minutes I think per week. That would be that would be a very good amount of walking, at least for the very first week of therapy. This will help him gain back muscle strength and mobility of the right leg, like we said before. And that is it. Thank you, everybody, for listening to my presentation. And hope everybody has a great day. Have a nice